Hi friends, this is Parvati from OPRA Capsticky. Welcome to my channel. I need your support. So please subscribe, share and like my videos. Also you can mention your valuable comments in the comment box. Today I'm uploading here the video for pharmacology, but I didn't prepare the PPT. Today I'm uploading a video. The link is mentioned in the description box. You can check it on there. The files are attached in the Google Drive. Okay. It's contained today video. It's contained almost 11 chapters. It's mainly related to the hormone disorders. In the first chapter, that is pituitary hormones. So what are the important pituitary hormones, anterior pituitary hormones and posterior pituitary hormones? We want to study thoroughly about that one. We can expect the questions related to that topic. Okay, and also some other important topics also we are discussing on there. Hormonal level maintaining pathway in our body, that one we want to understand thoroughly. So if you understand thoroughly, the remaining portions it's very easy to understand. Okay, because of that I am stressing that point. Okay, and the remaining portions, important one, adrenocorticotropic hormone, corticotropin, and gonadotropin releasing hormone. What is Addison's disease, Cushing's syndrome, what are the hormone level variations from there? We want to study thoroughly about that one. We can expect the questions based on that. Okay, and the other important topics remaining in that one, synthetic form of somatotropin and somatostatin, GnRH, and also inhibiting hormone prolactin. These are the important topics we are discussing there. And whatever the important points we want to study thoroughly, I clearly mentioned in the science like important, very important, and some of the points I highlighted with red ink or some other ink. Okay, you want to thoroughly study that one, and this note is very condensed form and very easy to study. So please thorough with each and every point. Okay. And the next chapter we are discussing thyroid hormones. Everybody know that one. It's very important topic. Mainly the hyperthyroidism, hypothyroidism, how the hormone level variations on there, and hormone maintaining pathway, thyroid hormone synthesis, how it's going like that on there. We want to study it thoroughly. And also the treatment of hyperthyroidism is also very important. Okay, these are the important topics in thyroid hormone, and whatever the important points I highlighted there and I mentioned the science on there, thoroughly study it. It's very condensed form, very easy to study. Okay, and the third chapter we are discussing diabetic mellitus. Okay, what are the three types of DULS and type 1, type 2 diabetes mellitus, insulin preparations and types, oral hypoglycemic agents, and sulfonylureas. It's very important topic. And what are the classifications on their drug classification, that is also very important. Okay, sulfonylurea, one of the important topic we want to study thoroughly, mainly the drugs. Okay, also insulin also very important. Okay, so you can check it, what are the important points I highlighted there. You can check the attachment. Okay, and the next topic we are discussing in that one, estrogens and androgens. Also in that topic we are discussing about the contraceptives and anti-androgens. It's very small chapter and very important points only I mentioned in that note. You can check it. Okay, and the next topic we are discussing on the adrenal hormone. We know about this one, aldosterone, and uses of aldosterone is also very important. In this section we want to know it one pathway, that is arachidonic pathway. I mentioned on the left side of that one, left or right side, you can check it, that pathway also. So if you understand that pathway, the adrenal hormones remaining portions easy to understand. Because of that I highlighted that one. Okay, and order of potency of steroids is very important point. We can expect more questions based on that. We want to study thoroughly this topic. Okay, and it's also very small chapter. Okay, the next topic we are discussing on the drugs for other disorders. In that one we are discussing about the treatment of osteoporosis and drugs for bone disorders. These are the important one. And the other important topic in this section, biphosphonate. So many important points are there. I highlighted and I mark it clearly. You want to study it thoroughly. It's very condensed form, so you can easy to study. Okay, And the next topic we are discussing on there, drugs for anemia. Mainly we know about that one, iron, folic acid, cyanocobalamin, hydrocobalamin, and some of the drugs remaining on there. We want to study it thoroughly, and iron calculation also there. That is also very important. One table is there. We want to study it thoroughly. That value is also very important. And one calculation also I mentioned there. You want to check it, that one. Okay. And the next topic we are discussing on there, peptic ulcer disease. What are the classification and drugs for using for the peptic ulcer, also very important. We want to thorough it clearly about that one. Okay. The next topic we are discussing on there, antiemetics. Mainly the classification is important one. In this topics like antiemetics, antidiarrheals, laxatives. In this section, the classification is the important one. We want to study it thoroughly about that one. We can expect the questions based on the classification mainly. Okay. And it's very confusing also. Because of that, we want to thoroughly know about the classification. Not only these chapters, the whole chapter in pharmacology, the classification and subtraction is very, very important. If you know thoroughly about that one, it's very easy to understand. And the next one, next chapter, urologic disorders. There is also drugs, drug classification is there. That's very, very important. And the drugs using for the benign prostate hyperplasia, that's also one of the important topic in this section. Okay. And the last chapter we are discussing in this section, drugs for dermatological disorders and topical antibacterial agents. These are also mainly the classification based questions. We want to thoroughly know about the classification, and some of the important points also there I mentioned clearly and highlighted with some other marks. You can check it on there, and it's very simple. You can check the attachment, and my previous attachment also attached in the Google Drive. You can check it, that one also. So in this section we are discussing 11 chapters. Okay, today I'm just wind up here. Thank you. I need your support, so please subscribe, share and like my videos.